My name is David Desiderato. I work with the Universal Healthcare Foundation of Connecticut. And it's great to be here for a number of reasons. One, that I live about 2 miles up the road in Granby, so my commute home is less than it was Thursday when I was in Danbury. We've been doing these public education sessions about the Affordable Care Act and Access Health CT around the state since July. And I'll tell you, as somebody who's been working on healthcare reform for a bunch of years, it's really, really nice that people want to know. Because sometimes you feel like you're preaching, and now people are calling us. So we have requests out the wazoo, as they say. Let me just say a couple things. First of all, does everybody get a sign-in sheet and the 3 handouts up front? And I have other handouts for later, but great. I'll tell you about the Universal Healthcare Foundation, and we'll do that first. So people probably haven't heard, I bet nobody's heard of us, right? Universal Healthcare Foundation? Almost nobody. So we were formed about 15 years ago when Blue Cross Blue Shield was taken over by Anthem. Do you remember that? It was a mutual company owned by its shareholders, by its customers rather, and a for-profit company, Anthem, came in and bought them out. And then a bunch of groups rose up, the Attorney General, the United Auto Workers, the Connecticut Citizen Action Group, and some others, and said, wait, those assets that you're taking were created by the people of Connecticut over many decades. You can't just take them and distribute them to stockholders worldwide. So there could have been a lawsuit, and it could have gone on for a long time, but instead there was a settlement, and money was put aside in a fund to achieve universal health care, so that everybody in the state would have access to quality, affordable health care. Which we obviously don't have today, don't have in the United States. So that's where our foundation came from. Great, we're timing out. Great. Let's see if it just comes back to life. Yes, wonderful. It's always a question of technology. You may have heard of a piece of legislation called Sustanet. I know there's some people in the room who worked on it. How many people have heard of that, Sustanet? Great. So in 2009, we passed sort of a piece of legislation that's like a roadmap to universal health care. We overrode the governor's veto. It was a really big campaign. A lot of people were involved. And it was produced before that by hundreds of people in the state getting together in various work groups and figuring out what would make sense. And it had a lot of features in it that the Affordable Care Act, which was passed 9 months later, had in it, like pooling risk and emphasizing prevention and that kind of stuff. But the federal law basically sidelined any state efforts and said, this is the game in town, let's play it for a while. And that's the approach we're taking. This is a very promising step forward. It's not perfect by any means. And in 2017, the states have more freedom to program the federal money and design a system that fits them better than what we have now. But for the next few years, we're working as hard as we can to make this the best possible system that covers the largest number of people. So part of that is making sure everybody knows what it's all about. And that brings me to the next point. There's been more said about this act on TV and you name it. We've all probably gotten sick of it before it was passed, as it was getting passed, since then. And I just want to ask you to forget everything you've heard before, because the vast majority of what you and I have heard is opinion, invective, bile. It's wrong. It's rumor. And this is this is the fact zone. And I know some people here are really, studious and have gotten the facts before, but in general, there are very few facts out there. And when you leave today, you'll be one of maybe 2,000 people who understand it as well as you do in the state, who understand it this well. And that's just, it's unfortunate, but it's true. So we're trying to do this one step at a time, doing several of these a week all around the state. We've been working with the Librarians Association. When we do this with librarians, they say, oh great, I want this for the general public in my library. And I now know how to deal with people who come in and say, what about this Affordable Care Act? How do I benefit from it? And there are even some libraries that have sisters. If you don't know that term, you will soon. So that's one thing, is just forget everything you've heard before so you don't have this dissonance about why is everybody against it if all these facts are true. Second, we found that people have a lot of questions, and about 80% of them are answered with, we'll get to that. So I'm going to ask you to hold your questions until the end of each section, which means about every 10 or 15 minutes I'll stop and say, great, you have questions. That you could use that front page to write down your questions. Please do. If I'm using a word or something that, or a phrase or a concept that you need to know the answer to or else you can't understand, please interrupt me. But otherwise, don't hold your questions for 10 minutes and I'll promise I'll answer them. And at the very end, I promise I'll answer, so I'll stay until the last question is answered. Folks, there's a sign-in sheet and some materials right over there.
Oh, okay. Okay.
Thanks. And then my last question before we start is just let me get a sense of people in the room. How many folks have been, have themselves or in their family or friends been without insurance for, not just a month, but half a year or years, or something like that? How many people know people who've been without insurance for quite a while? Okay, that's good. Because if you've been insured all your life, sometimes it's a little hard to know how important it is to have health coverage and just, the significance of this. So, okay, so you ready to roll? Okay. So, the Affordable Care Act is a big deal. It's like Social Security, it's like Medicare. It's a big step forward for our nation and a big moment in our history. And it really couldn't come at a better time. We've been struggling in the last few years economically and socially and culturally and in a way that maybe our parents' generation, wouldn't have struggled. And questions like this that we have around the dinner table, that we wake up with in the middle of the night, are just a lot sharper than they were a few years ago. And so we're fortunate that we have an act that's going to give us a little more peace of mind, both by helping us improve our health and also by removing some of the financial burden of paying for care. You probably know that 60% of personal bankruptcies are due to medical costs. That's a big deal. So, like most countries, we're on our way to universal health care. And most countries haven't arrived there. So there's a sign-up sheet and some materials right there. And it's our own unique path, just like every other country is on its own unique path. The Affordable Care Act takes some really big steps forward toward quality, affordable health care for everyone, but it doesn't do everything. And tonight we're going to talk about it in a few ways. First, we're going to talk about what's wrong with healthcare now, very quickly, some big numbers that you probably know, but just to refresh yourselves. Two, what's in the Affordable Care Act? And the approach we take is sort of a macro approach. What are the three big areas that are included in the Affordable Care Act? And that's pretty quick also, just to get main concepts across. And the third is we're going to focus on Access Health CT. Now, who in the room knows who that is, or what that is? About a quarter of the population. It'll be 100% by the end of the evening, I promise you. So this is our new health marketplace. It's a level playing field. Think of it like Travelocity or Expedia or Amazon, where you can easily compare products side by side and get a decent price and one that fits you. And it affects individuals and families, and it affects small businesses. It doesn't affect people on Medicare. It doesn't affect people in large corporations, more than 50 employees. And
Are businesses up yet on Access Health?
Pardon me?
Are businesses up on Access Health?
Are businesses up?
Yeah, I mean, can you get quotes from?
Yes, yes.
Okay.
So at the beginning, I asked folks to hold questions.
Sorry.
Unless no, it's all right. You just came in. When we get to the end of each section, I'll ask you a question, okay? Because otherwise, what I'll be saying to you is, we'll get to that, I promise. And then we'll talk about some next steps if there are any. And we're really not going to talk about Medicare or big employers, because the Affordable Care Act is aimed at the parts of healthcare that were the most a mess. And Medicare basically runs pretty well. Big employers generally provide affordable quality care, less so, they're all under pressure, but those are not the biggest, most acute areas of problems in healthcare. So the Affordable Care Act looks elsewhere, uninsured, underinsured, and small businesses. Okay, so just to get warmed up a little bit, let's take a couple of examples. Let's look at two Connecticut families and see how the Affordable Care Act is going to affect them. And we'll look at this stuff in more detail. later, but just so we have a couple examples up front. So, I don't know, I'm 57, I identify with these folks. I was out of work for a while, my wife was carrying a burden. We were paying close to that, not on COBRA, but she was working ostensibly part-time. So this is a pretty common thing. We hear about this all the time. That's a lot of money for somebody to be carrying on not a big income. And you know, most of us who are 58 have some pre-existing condition and face high insurance costs. So what's going to happen with them with Access Health CT with this company? Let's go check it out. So this is the calculator. Probably many of you have been on it. You plug in your county. They live in New Haven County. They're 58-year-old spouse, and they plug in at the bottom their income. And let's see what the results are. Well, they're eligible for a discount on their insurance of $1,100 based on their income, which is a huge amount, right? And these are the first two of the plans that come up when they go to the next step. So this amount, $287 or $303, that's how much the insurance would cost them out of pocket after the discount. So if you add those together, $287, $303 plus $1,100, that's a whole lot less than the $1,800 that they were paying. And even if they have a full income and they're able to afford the full amount, it's still less because of the ability to buy in bulk. But right now, while their income is really low, they're able to buy affordable insurance. I mean, that's $20,000 a year. And of course, they'll go and they'll check and see if their doctor is in network, and they'll read the plan description so they know what's covered exactly what the benefits are. So let me ask you, do you think it's a good news for them? Is Access Health CT going to work for filling their needs? And it's a pretty cut and dry case, right? Okay, so let's look at somebody else. Claudette, she's a single mom. She's got 2 kids. She works 2 part-time jobs. Maybe she works 50, 60 hours a week. We don't know, but she works hard. One of them offers insurance, but it's really unaffordable. We've all heard stories about people who were offered insurance, but it costs so much they can't possibly take it. And the boys are on Husky Medicaid, so they're okay. And she's probably thinking, well, I can get by without insurance. So let's plug her numbers into the calculator and see what she gets. So the calculator says, oh, your income makes you eligible for the kids to be on Husky. Now they already are, the calculator doesn't know that, but that's a good thing because it reminds her, gee, if my kids aren't on Husky, I can get them covered, that's great. And then it says she could get a discount of $133 or so, and she doesn't know this, and the calculator doesn't, but if her income is a little bit lower, she'd be eligible for Husky Medicaid too. Because the idea is if your kids are on Husky and the parents are on Husky, they're much more likely to get, the kids are much more likely to get care. So this income level is higher for Husky parents than for regular parents. So we look at what it's going to cost her, $212, $216, those are the 2 top plans, the lowest cost plans that came up. So what do you think? She's got a couple options here. She could sign up with Access Health CT for $200 a month. She could do that unaffordable employer plan. She could stay uninsured. And the penalty for her is about $300 for 2014. Goes up in the future, the annual penalty. So what do you think? What would you do if you were Claudette?
Take it.
Take it?
Yeah.
Like get insured?
Yeah.
Yeah? What do other people think? Does everybody think that? Does anybody think something else? What's going through your mind?
The discount, does that get reimbursed at the end of the tax year?
No, the discount is it's like a grant.
Okay.
So she would pay this. She'd write a check every month to Connecticut in this amount, and Access Health CT would pay the rest, whatever that is. We don't know what it is. It's probably not too much more than that, $100 or something. So really, the question is, if you make $40,000 and you got 2 kids, can you afford at the end of the month to put $200 aside for health care? And what's it going to depend on? I mean, she might be really ill and absolutely need the health care. She might be really ill and not know it. She might have some high risk in her family and know that she needs to have health insurance. She might not. She might think, I'm healthy, I'm young, I'm going to put my money in my kids. Make sure they have extra backpacks or tuition or clothes or whatever. So just the point of this is that it's not always as clear whether people benefit or not from Access Health TV. So we have to be honest. The bottom line is the Affordable Care Act is really great for some people, and it's not so clearly great for other people. And that has a lot to do with how the process happened, how it occurred in Congress, and the compromises were ended up that way. A lot of us fought for making it more affordable, and we sort of wanted to save cost. So try to keep those, Claudette and Phil and Marion in your head as you're looking at these, because it makes it easier. So we're done with the introduction. Questions? What do you got? Yes, sir.
The difference between the deductible and the out-of-pocket maximum,
Yeah.
I tend to use those terms interchangeably.
Yeah, and it's even worse because they have new meanings. So people might have noticed on the right, when we were looking at those the top two plans, it said a deductible, I think one was $6,000, one was $2,000. And you think, that's a lot of money to have to pay out before you access the insurance. It's not that kind of deductible. It only kicks in when you have really big expenses, like you're in the hospital for a while. You might have to pay up to $2,000. You might have to pay up to $6,000. But for routine medical, it doesn't come out of that. And every dollar you pay for a copay goes toward the out-of-pocket maximum, and the out-of-pocket maximum says you can spend $100,000 in the hospital, but your maximum is $6,000 or $12,000 depending on your income. So you're protected from these huge extra costs if something serious goes wrong. And we'll come back to that when we look at the plans individually. The nicest part of this is that since we're online, we can go to the calculator, put in some real life examples yourselves, somebody you know, and find out exactly how it works and dig in a little more. So but that's good. It's good to ask that question up front.
Are you going to go over examples for businesses as well?
Yes, yes.
Because we've been unable to figure out how to get on Access Health and get a quote.
Okay, I'm probably not going to be able to get you a quote because it's really complicated, but we have several brokers in the room who would love to walk you through, who I know have had success. So actually, can the brokers just say who they are, and then I'll ask for the sisters also? Dave?
Hi, I'm David Richmond. I have an agency right across the street. Been in town for over 20 years. Primarily do group insurance for businesses. However, after 30 years of doing this, we felt it would be important just to be more of an educator and just to be transparent. We get paid by Access Health to sign you up and to explain everything that David's explaining tonight in a couple of hours. It takes about an hour to sign an individual up, and for a business it could probably take a couple, 2-3 hours. But that's what we do. We've been here for a long time. I've educated my kids here in town, and now I have to pay 2 tuitions, so that's why I'm out tonight.
I'm John Kuja. I'm located down in Avon. I decided to get into this part of the business. I'm really specializing in Medicare right now, but thought that this was important, and a lot of people need help here from a consumer standpoint. And even though Access Health is a pretty good program, it still can be pretty complex determining what it is that you should be taking. And as Dave was saying a moment ago, we're reimbursed by the carriers. It doesn't affect your premium at all. There's no impact on the premium whether you work with a broker or you don't. So if that'll help you, we'd be more than happy to assist.
Yeah, sir, everything I've heard is that small businesses can try all they want, but it's going to be really hard. You need a broker. Individuals, it's still hard, but they can sign up on their own. So I just encourage you to meet up, afterwards, whatever. And Edith, do you want to say hi as a up-and-coming sister?
Okay, I am somebody who will be able to help people with the enrollment process. Let's say you tried going online and just need a little help. I went through the training, and I will be certified soon to be able to do that.
So Edith's also from Simsbury in town. So any other questions before we roll into what's wrong with healthcare? I'll do this fast because we all know. I mean, the quickest way is to do a quiz, right? Why does the kids have all the fun? So you all are smart. How many people in Connecticut have no insurance whatsoever? What do you think? Just throw some numbers out there. Guesses are okay. 20%. How about in raw numbers? Just so we can...
I think it depends on how you define insurance. Some people just walk into the hospital and that's their insurance.
I don't think that's insurance. Insurance is you pay.
It works.
Yeah, you're covered every month by an insurance company. Those people are uninsured. So how many of those people are there with no insurance? this? Any ideas?
500,000.
500,000, 20%? Okay, well, the number we're using is 300,000, and this is actually good news, because ever since the Affordable Care Act was passed, it's been going down. I don't know if you can see it, but the 384 in 2010, and now it's 284. 284, yeah, and that was just a couple weeks ago. So as the Affordable Care Act has been slowly implemented, different things have happened, and other things have happened too. We've gotten poorer, more of us are on Medicaid. We've gotten older, baby boomers, more of us are on Medicare. But one big thing is the under 26-year-olds are able to stay on their families' plans now. And another thing is no discrimination against children. So those kids who were uninsured before, now they're insured. So our rates of uninsured are going down. We're using 300 as a nice round number, because who knows, maybe it'll be up a little bit next year.
The ACA doesn't take effect until 2014, so
Oh no, a lot of it has been in effect already. And
So
get
the
to some of
decline
this-
has got nothing to do with ACA.
Pardon me?
The decline then has got nothing to do with ACA.
What I said was a lot of it has gone into effect.
Kids are on now.
I want to refer you to that two-page dense reference that's got a ton of information about what's already happened. Okay. So others have insurance, but they pay too much, or it doesn't cover everything they need. What do you call them?
Underinsured.
Underinsured. People didn't know this word just like 5 years ago. It's big. Now, healthcare costs are taking up more and more of our economy, a larger portion of the gross domestic product. How much of all the goods and services and all the money that flows back and forth do you think healthcare accounts for today?
17%.
17%? 30%? That's the answer today, 18%. Now, what about in 1980? What do you think? Just 3 decades ago.
7.
10%, 7%. Boy, we're doing great. 8%, you got it right on. So what's happened between 1980 and now? Where did all that money come from? I mean, our incomes have not risen, right? In real terms, inflation adjustment. So where is the money that we're spending on healthcare come from?
Rising prices.
National debt.
We have a huge amount more debt. That's right. And what else?
From other discretionary spending.
Exactly. Food, clothing, transportation, you name it, education. All those things that we feel stress about at the beginning, that we all identified with, that's part of that stress is we're spending so much more on healthcare. We don't have so much money to spend on everything else. And it's like the frog in the water all the time. We're feeling the stress, but not really noticing the causes. And this is how it looks as us as a country. We're in the lead here in terms of health spending. This is back in 1980, we were at least in the pack, but we've completely failed to control our healthcare costs, unlike all the other countries in the world. Now we spend a lot of money compared to other countries. What's the quality of our healthcare? Is it better or worse?
So much worse.
Worse? Anybody see better?
Our quality?
Much better.
Best in the world.
Best in the world. Okay. Well, it sort of depends on how you look at it. If you look at a few people who are really insured and who really need some great specialized care, we do pretty well. But if you look at it the way health is usually measured compared to other people, like the infant mortality rate is probably the best overall way of measuring one country against the other. How well do we keep our population? How likely is it that if you're born, you're going to make it to your first year? And we'd like to be in the first 10, right? Because we're number 1, right? Maybe in the second 10, or we should be ahead of these countries, right? We're number 47 in the world in infant mortality. And this is the CIA fact book, the World Health Organization, the United Nations. You consult any of them. Maybe it's 45 in one and 51 in another, but the facts are indisputable, and we're getting worse. It used to be that we would hopscotch with Cuba. They'd be ahead of us one year, we'd be ahead of them the next. And people couldn't digest that. How could we be behind Cuba or tied? And they're way ahead of us now. Think about life expectancy. How long are we likely to live? We'd certainly like to be in the first 25. We're not. We're not even in the top 50. Same sources. We don't do this. We always use these numbers because, we compare ourselves against other countries because it's crazy to wonder where does this Affordable Care Act come from if you don't know where we're starting from. We have to start from the facts. These are the facts. And when you understand the facts, then you have a better understanding of why this act was created the way it was. And it's a shock to most, it's a shock to me. I'm an American. I can't stand this. This is wrong. It should be, okay, maybe we shouldn't be number 1, but number 5, 10, 15, 20, somewhere up there, right? Here's where we're going. In the last 10 years, premiums have gone up 4 times faster than wages. The last 14 years. Healthcare here costs $8,000 per person, $3,000 in other countries that we compare ourselves to in the developed world. 30% of our healthcare costs don't improve health; they go to other things. And 75% of what we spend on healthcare is spent on diseases that are largely preventable, like diabetes or heart disease. I mean, we all know people who didn't get treated early, right? And something happened, who didn't get managed well because they didn't have good coverage. The source of this is a wonderful movie called Escape Fire, which I'm sure is going to show in this library at some point, which is not about the Affordable Care Act at all. It's about what's wrong with healthcare and how we can fix it. So let's just pause and look back a little bit. How did we get here? Why are we in this different situation from other countries? So we're looking at root causes, and one of them is we don't have a system. We talk about a healthcare system, but I try really hard not to say system. Our care is not coordinated. You might see one doctor for mental health, another doctor for your tennis elbow. They both prescribe different drugs. Nobody knows if they're countereducated because nobody has the overall understanding of your health, and that's just a tiny example. Payment is not based on, it's not tied to quality. It's tied to all kinds of other things. You might get a great hip replacement or a mediocre hip replacement. The people who did the hip replacement are getting the same amount from the insurance company or whatever. Either way, quality is enforced through the court system, which is about as blunt an instrument as you could, an arbitrary as you could imagine. Coverage has nothing to do with whether you need health coverage, whether you should be seeing a doctor every day, whether you've got family history that says, you better watch your health. It has more to do with where you work, or where you live, or who you're married to, or what your income is, your gender, your age, all that other stuff. And the data that we need desperately to figure out how to hold people accountable, how to have best practices and good quality healthcare is all over the place. Your doctor has some, the hospital has some, the insurance company has some, the government has some, and we don't put it all together. So maybe in that hip replacement, there's 6 ways of doing it, and one is old-fashioned and shouldn't be done anymore, and 2 of them work every time, and there are a couple in the middle that work sometimes. We don't have enough data to say, don't do that one that doesn't work anymore at all, ever again, you won't get paid for it. We don't know that. So here's another area of an underlying root cause. We have a lot of motives at work in all of our lives, right? And some people go into medicine and into healthcare to save lives, to reduce suffering, to promote health, and they just want a paycheck, and they want to be able to raise their family and have a decent life and make a living. And then other people go into it to make a fortune, to make a killing, to boost stockholder profits, to do all the stuff that have kept pharmaceuticals at the top of the heap of all industries for the last 4 decades. And it's really hard to come up with solutions that satisfy these 2 powerful motives in our society. So health reform is elusive. It's hard to come up with reforms that really satisfy those. And then maybe underlying all these root causes are all these ideas and beliefs that we grow up with, that we carry with us throughout our lives, that we learn in church or home or whatever. And one extreme might be everyone's on their own. Pull yourself up by your bootstraps. And you might say, if you believe that, well, you don't have insurance, we'll just get a better job. Or you have high blood pressure, well, you should join the gym, exercise, take better care of yourself. And the free market, the companies, we just get government regulation off our backs, that'll solve all the problems. And the other end, it might say, we're all in this together, and since we all pay extra for people who are uninsured, because someone's got to pay the hospital bills, someone's got to pay through the higher taxes, we all pay higher premiums and taxes to care for folks, so we might as well get everybody covered so they can get the care in time and it doesn't cost as much and it's less suffering. Or we need public programs like the Affordable Care Act to step in where the free market hasn't succeeded. And we have examples of this throughout our history, right? The Midwest, our grain belt, would not be electrified now if government hadn't stepped up and said, okay, the private utility companies, they're saying it's not economic for them to run the power lines out there, so the government, the public will pool its money because it's so important that we have farms that are alive, we get electricity, and we'll create the Rural Electrification Administration. That's one example. A lot of times in our society, there's a limit to what private companies can do, and as a result, we see this, widening gap between the cost of healthcare and insurance and our incomes, and it gets worse and worse and worse. And so it's inevitable in that situation that people rise up and say, we need care, and if private companies aren't going to do it for us, we need public companies to help. So, do we carry these in our head all the time? Do they run into each other? Yes, we all have parts of these in our minds at all times, and lots of other ideas also that conflict. But they all add up to reasons why we have to plot our own unique course toward health reform. So what do you think? Does the Affordable Care Act address these root causes?
Yes and no.
Boy, you're
I don't know.
getting it every time. Yes, we say yes and no. It gives us a lot of tools. It lays the groundwork. It gives us a lot of things that we can do to get to a better health system, to a real health system. But it's up to us to grab a hold in our families, in our municipalities, in our workplaces, as health providers, as governments, state government. There's a lot to be done. So that's why I pause and ask for questions or comments at this stage. All going okay? Just go right on. Okay, so now we're going to talk about the Affordable Care Act. Last chance. Okay. We could spend a while on what the Affordable Care Act is not, and it's really kind of fun to go look at the opinions and contrast them. So I'll just do it really quickly. It's going to double your rates. No, it's helping people every day. It's a massive government boondoggle, a train wreck, but we really need it. And it's an epic disaster. And anyway, that was a burning dirigible crashing toward Earth, ending life as we know it. That little video. But unfortunately, the truth is less sensational. It's all about the facts. It's not about all this stuff. The truth is that the Affordable Care Act does not turn health care upside down. The health economy stays in place. Doctors don't lose their practices. Insurance companies don't go out of business. They're doing just great. United Health posted record profits last couple days ago. No cuts to Medicare. Medicare is slightly affected and improved. The donut hole is eliminated over time. Preventive care is free. People entering Medicare are going to be healthy. But these are small effects compared to what's happening in other sectors. And most people keep the coverage they have now, because most people work for a larger organization, over 50 people, and most of them provide health care. And if nothing happens, the only thing that happens is that they have to be they can't have, the employers can't offer crappy insurance anymore, to put it crassly. So the Affordable Care Act is really health reform, American style. And here are the three big impacts that we think if you keep these in your head as the sort of container for what it does, then it's easier to remember all the different little pieces of it. So first of all, more people get access to care, right? More uninsured and underinsured people get access. 2, insurance policies are much fairer for everybody who has insurance, almost everybody. And 3, we get better value over time, which means better quality and lower costs. So we're going to look at each of these, a couple of examples that are hopefully familiar. So more people get access to care in 3 ways. Medicaid expands. In our state, we've already got Medicaid expanded, so this is mostly childless adults, 60,000 people who now have to make half of the poverty level, which is like $7,000 in order to get health care. So if they make $8,000, of course they can't afford a doctor. And of course, if something happens, they go to the emergency room, and of course, we wind up paying for it. So now they're going to be covered with a regular income stream through Medicaid, and they'll be able to get a doctor and catch things early and get help. Second, discounts or subsidies are going to help families and individuals all the way up into the middle class. So, discounts stop at $94,000 for a family of 4. So it's a pretty decent income. It's clearly middle class income, even in Simsbury. And tax credits help small employers afford insurance and also make bulk buying possible for the companies that don't qualify for tax credits. So we'll go into detail about all of these a little bit later. So the second one is fairer insurance policy. Discrimination. Insurance companies have stayed alive and prospered by doing a better and better job every year of making sure they don't insure people who cost them money, right? So they have great ways of selecting out people who are at higher risk, who are older, who have pre-existing conditions, et cetera. So children, for 2 years now, have been, can no longer be discriminated against because of pre-existing conditions up until age 18. And in January, that covers adults as well. So no insurance company can say, we're going to raise your rates, or we're going to not provide insurance because you have asthma, because I have gout, so before you have gout, because you have a history of X or Y. It's no longer possible. So that's one example of the kind of discrimination that's no longer possible for insurance companies. Transparency, we're kind of spoiled in Connecticut. We can read our consumer contracts because we have plain language laws, but that doesn't really apply to medical. You ever try to read an insurance bill or a hospital bill? That kind of stuff becomes a lot easier in a few months so that we can be better advocates for ourselves instead of just giving up. It's so difficult to have insurance. That's an example of transparency. And then we're getting more health care for our healthcare dollars. Remember that 30% of healthcare costs go to non-health. Starting last year, and there may be some people in the room who got a check in August or September this year or about a year ago from an insurance company, and they wondered what was this for. Well, now insurance companies are required to spend 80 cents out of every premium dollar on healthcare. And if they spend more than 20% on, commissions or their offices or executive salaries or advertising or whatever, then they have to remit that to their customers. Anybody get a check? Usually somebody in the room has got one, yeah. And especially if your employer covers you, they might have gotten a check. There's no requirement that they pass it on, unfortunately. But, so that's one way that we're getting more health for our healthcare dollars. And then the third category is better value, quality, and cost. There are two areas here. All that data that's all over the place, it's getting centralized. Not with the kind of power that says, you can't do that practice, you must do this practice. We don't have that. But we do have the ability now for like every medical specialty to say, this is the way you recommend that this operation is done because it has the best results, and now we know it for sure because we have so much more data about it. And second, we've spent so many resources on the specialty areas. We've really neglected primary care, which is why all those countries are ahead of us. So a lot of money has gone to community health centers to train new doctors. We have a new medical school in the state, right? You know about that? Connecticut University is a brand new medical school. Just started their first class, 60 students. And what's their specialty? What are they focused on? Primary care. So it's, we have a class of new doctors coming in who are focused on primary care. So a lot of money has gone into sort of prime the pump and make sure that there is the talent and smarts, and that there's the electronic medical records and all that stuff, so that we can enter, a new century. Okay, so time to quiz again. So 3 big impacts. More what? More people covered. That's right. Access to care. And here's an example: 23,000 young adults in Connecticut can now stay on their family's plans up until age 26. That's a lot of young people, right? My daughter's going to be 20 in a few days, so I'm happy about that. Fair or what?
Less discrimination.
Fair insurance policies. Less mistreatment, less discrimination, more transparency. And here's an example: 1.5 million non-elderly residents, because Medicare takes everybody regardless of pre-existing condition, same price. But folks before Medicare, 1.5 million residents will soon be protected from pre-existing condition discrimination. And better, I gave you that one, value, quality, and cost. And healthcare is cool because sometimes you go to the cheaper mechanic, you might get a worse job. But in healthcare, there's a huge overlap between lower costs and better quality. And there are examples all around the country, just like all around the world, of places where they charge half as much and they get much better results. So we have a lot of room to make up, and part of that is prevention. So now, almost 1 million people who have private health insurance can get, probably half the people here have gone to the doctor and said, what, I don't have to pay a copay? It's because of the Affordable Care Act. There's no copay for preventative health care now, because it's so important to catch stuff early, that the Act says, let's not have any barrier between people and their need to know upfront and get help. But let's be honest, it doesn't cover everything. Half of uninsured folks are not going to be covered after the first year. How many would that be? I'm so sorry, it's evening, I'm making you work.
150,000.
150,000, yay, thank you. You got the higher math corner right over here. And a lot of that's because it's not going to be affordable for a lot of people, or they're going to wonder. So, you know, Claudette, is she going to pay $200 a month or $300 a year? It's a tough call. Lower costs and better quality are not guaranteed. Again, we have a lot of tools to work with, but it's not a sure thing. And then we have a lot of disparities in our society. Age, race, ethnicity, gender, location, geography, and those are not eliminated either. And we can look at those, you know, a couple examples because disparities have been studied to death, so there's tons of statistics about them. These three have the word twice in them, and that's why I chose them, just to, you know, remind us. And there's one big thing that we could do that would reduce these disparities a lot. There's only one thing that really makes a huge difference. What do you think it is?
Equalised healthcare for
Yeah,
all.
it's access to care. If you have access to care, you can take all that good information about prevention and all that education and put it to work with the help of skilled medical professionals. And we know this for sure because Massachusetts covered more people in 2006. They boosted them from 83% to 95%. And look what came along with that. More people saw the doc, more people got preventive care, more people got good care. So what they've done in that 3-year period is eliminated the racial and ethnic disparity in access to health care. And we know what comes along with that is they're going to catch cancers and people are going to be healthier as a result. So we stand to do the same thing because we're expanding access, and a lot of people in our state are going to see a doctor, have a regular doctor for the first time. So here's where I pause and ask questions, comments, thoughts. Because we're diving into the meat now. This was all preparation. Good to go? Am I going too fast, too slow, too loud, too soft?
Good.
Okay. There's nobody saying much or protesting. Usually someone protests.
Maybe stimulating.
Good. Okay. So what is Access LCT anyway? It's the main event. It's the biggest single part of the Affordable Care Act. There's a lot that's been folded in over the years, but we've been waiting for the health marketplace to level the playing field to give us the ability to buy in bulk and buy quality, affordable health care. So that's why we're going to spend the bulk of the time on that. We're going to talk about it in terms of basically who it is and why and all that, how it affects small employers, and then how it affects individuals and families. And both of those, we're going to talk about the money portion. And since there are a bunch of small employers in the room, we're going to go to the website, plug in a couple calculations, a couple of examples, and see how that works. So here's their newish website. I just want to point out a couple things. If you click Get Help and you go to the next screen and you plug in Simsbury and you click Broker, you'll get Dave and I forgot your first name. John, you'll get a list of 5 brokers who are right in town. Some towns don't have any. You can do it by zip code, you can do it by organization. So that's how you get help to get signed up, and it's all free. Dental insurance, we don't say much about it because it's kids, dental, and pediatric is included in the health plans that are on Access LCT, all of them. But if you want an adult standalone plan, much like today, you have to get that separately. And that Can I Opt Out is about exemption from penalties, or we'll get to that also. And there might be an enrollment fair or something coming here. That would be under the museum events. Okay, so what is Access LCT anyway? First of all, it's the only place you can get these discounts. We're calling them discounts instead of tax credits for individuals because tax credit sounds like you have to wait till next year to get the money back. The discount is current; it happens at the same time. But you can't go to Aetna, buy an individual policy, and then file for a discount on your tax return next year. You can only get it if you buy through Access LCT. It's a customer-friendly health insurance marketplace where you can make apples-to-apples comparisons. And it's for families and individuals and for small businesses. And it's our organization. Why do we need it? To pool our buying power. There are 165,000 people in Connecticut who buy healthcare all on their own. They can't get a very good deal, right? We saw that with, we probably know people who are spending, $1,500, $2,000 a month for a couple to get healthcare because they're not part of the group. So this helps us buy as a group. It also helps us get better quality insurance better value at a lower cost because we're buying in bulk. And it gives us some new health insurance choices, which you see in a minute. So who is this? It's a quasi-public organization. It's open to, they have monthly meetings, they have public comment, you can read their materials, their minutes, they have to respond to freedom of information requests, that kind of thing. They're run by a board of directors appointed by the legislature, Republicans, Democrats, and the governor. And they have a staff of actuaries and finance people, and they're funded by startup funding. And in the long term, they're going to have to be funded by some kind of surcharge on insurance policies. But for startup, they get funded from the Affordable Care Act, which means from all of us. So it's really, it's our Access Health CT. We've built this thing to help fix the problems that are out there, and we're funding it. It's costing a lot to set up. Who else it is these navigators who you can ignore that because they're sort of behind the scenes, and these assisters like Ida, for help individuals and families, and brokers like Dave and John, who are here for small employers, but also work with individuals and families. And so they're a little bit more, especially the assisters are more like temporary staff. Brokers are probably here for the long haul. Okay, so any questions so far in the intro to Access Health CT? Yes, sir.
Just a philosophical question. If we're getting such great economies of scale by going statewide, why don't we go nationwide with an exchange?
That would be great. That was the original idea, and a lot of states want to run it on their own. And frankly, it looks right now like the states that have gone on their own are having much better luck than the national. But that might be a temporary hiccup. I mean, that's the single payer concept, right? And that was the concept behind Sustanet, was that you take the state employee pool, the Medicaid pool, and all the other pools of people and combine them and able to not only get the best price, but flow through all the smarts that we learn from each of those insured groups so that we get the best practices, the best health care.
Yeah. That's not a single payer, that's just a big exchange, which I think is a different concept.
Well, the bigger the pool, right? The bigger the pool is, the closer it gets to single payer. The whole idea of insurance is to spread the risk, right?
Right.
And what this does is spread the risk that formerly individual buyers were having, but we could even combine the pools so that they're even larger.
I think part of from what I understand, part of the answer is that all the states have their own domains and have, like the state of Connecticut for small businesses, you got 50 mandatory coverages. So if we as a small employer want to insure our employees, we have to get the policies that cover these things, including fertility benefits and all that stuff, which makes it, drives our costs up as an employer.
Yeah, but your legislatures who voted those in.
Oh, yeah.
It's not an insurance company.
Right.
No, I understand that. It's the government that drove the cost up, right?
That's why it's
Good healthcare costs real money. It's true. Whether having the national exchange or state exchanges works better, I don't know. You could go either way. There are pluses and minuses on both sides. So, any other questions before we go into employers? Okay. So. Just a word about large employers, and we hear all these, Walmart is cutting back people below 30 hours because they don't want to consider them full-time employees and have to provide health insurance for them. Cumberland Farms says, we're going to increase the number of people who are 30 hours because we want to invest in our employees and make sure they have health coverage and they'll last a long time. Forever 21 says, we deny that we were trying to cut people's hours. Starbucks says, we have a long-term policy of getting people. So there's going to be a lot of churning going on because they are required, large employers above 50 or more, they are required to provide quality, affordable insurance. And most of them do, but there are plenty out there that don't. So the Affordable Care Act sort of says, let's have a level playing field and not have some companies taking advantage of other companies by not providing, this costly coverage. And if they don't provide health insurance, they have to pay a penalty. And I think it's $2,000 per person if their employees go and qualify because the only insurance they're offered is unaffordable for their insurance, and they have to go get insurance at Access Health CT, and the employer gets a penalty. Now this was postponed for a year, so we're going to see this continued churning as companies position themselves. And frankly, as consumers, these are all public companies. We have a lot to say. We can say, I'm here at Cumberland Farms because you cover your employees more. Shop at Costco instead of Walmart or whatever, or the other way around. So that's enough about large employers because there really isn't a lot of impact there. But fewer than 50 employees, This is probably the biggest misnomer out there. There is no requirement that small employers offer health insurance. There's no requirement today. There's no requirement as a result of the law. There's no penalty. There's no disincentive. Small employers are really, they have the best of both worlds. They're not required to offer insurance. There are no penalties if they don't. And they can buy, for the first time, many of them discounted because it's bulk buying insurance on the exchange. And if they're smaller and they meet some other conditions we'll get to in a minute, they may be eligible for tax credits to actually help them to subsidize their purchase of health care. So we say small employers, it's all carrot, no stick. And the enrollment for companies starts October 1. It runs, it's year-round. For individuals and families, it stops at the end of March, so 6 months. But for employers, it's year-round, anytime. And the companies that provide health insurance to small employers, Anthem, United, and Health ECT. And dental insurance, they're provided by Anthem and MetLife. And there's no membership fee. If you run a small company and gotten insurance, you might have had to join the Connecticut Business Industry Association, or a Chamber Trust, or a professional association, or Potter's Unanimous, or Anonymous, or something, to get health care. You don't have to do that. This is all provided free with the help of these brokers. Now, if you're a very small employer, under 25, you're eligible for tax credits to help afford insurance for your employees if your average wage is less than $50,000, and you, the employer, pay at least half of your employees' premiums. And here's how it works: it's 50% of the employer's premium cost for a for-profit, 35% for a nonprofit. So if you spend $50 a month per person, you get $25 back, less if you're a nonprofit. And you might think, where's the nonprofit? What's that being? They don't have any profits to offset. Well, it's offset against their payroll taxes, Social Security and Medicare taxes.
It's up to 50%. It's not necessarily 50%.
That's right. Thank you. And it's weighted towards smaller companies and lower wage companies. So that's I should put that in there. That's good. Fewer words the better, but that's an important point. Thank you. And here's the small business website, and it's got this explains the extra things that you get. This is a really cool thing that only Connecticut and 2 or 3 other states have, because we're more advanced in the shop exchange. If you had 10 employees, you could give them the entire range of plans available through Access Health CT. They could each choose a totally different one, and you still, as the employer, write one check, and Access Health CT sends it out to the various insurance companies. That is a very rare thing. It's a really wonderful thing that we have here in Connecticut, because we've gone our own route and preserved the importance of the small business. That's called a shop exchange. So how many people are interested in small business in the room? One?
We're trying to make a decision right now, but can't get any prices. So we got to.
Let's do one example then, okay? So this requires some magic, and just gonna hope it works.
Our premiums went up to like 37% this year.
Okay, so it's bigger than usual, but I guess it's okay. So we're gonna go. Where should we go here? Where's the calculator? Enroll online. Do you guys know this has changed since I looked at it last year. Well, let's see if you're eligible for tax credits. Okay, so that's what it says you have to do. All right, anybody see what I should be doing here?
You want to enroll?
Enroll now? Because I don't want to put in all the. Where'd it go? That's interesting. Wow. Let's try going back.
As close as I could go, was we got an application we could print out and mail in.
Need me.
That's definitely what I've heard, that it's really not worth trying to figure out. It's a small business. It's too hard. I'm not going to fuss with this too much longer if it doesn't work. Roll now. traffic kicks me out.
Yeah, so,
Okay, either this isn't working or it's working differently. Anybody got any suggestions?
well, we were told that the pricing is not gonna be on there until mid-November for small businesses by somebody.
You said the prices are out today for small business.
And where does a small business go to the mill?
All right, there is no calculator right here.
Could come back next week.
Yeah, or work with the broker. Most important thing. Okay.
And one thing you didn't mention about small businesses is they've really taken the chin on pricing. We probably pay, I would expect, probably about 50% more than a large company pays for employees.
But much less so because you'll be able to buy as a bulk instead of on your own now.
Well, that's what we're looking to see.
Yeah.
You know, if we can get prices, I could either agree with you or not. But,
Yeah, it's certainly true in the individual market. I guess we'll find out soon. Okay, any questions before we go on to individuals? All right, so when does enrollment start? It's already started. It goes for 6 months. Next year, it's going to be just, the usual 2.5 months. But for this first 6-month period, for the first year, it's going to be 6 months. And the coverage starts January 1. If you sign up by December 15th, you get coverage January 1. If you sign up by January 15th, you don't get coverage till February, etc. And this is good news. But it's bad news if you don't sign up by the end of March. And let's say you get sick in April or May, and you don't have health coverage. You can't go and say, "Oh, I think I'd like that health coverage." You have to wait until October to sign up for January coverage. The exception is if you have a life event, which Cobra uses this phrase that it's, you get divorced, you lose your job, something major happens in your life. It's not your health. Then you can sign up. You move in from out of state, you can sign up outside of the open enrollment period. Otherwise, it's just the 6-month period. So how do you enroll? Look at all these ways. You can do it online. You can do it in a phone call. You can work with IDA or 299 other sisters across the state that are based in community-based organizations. And these navigators coordinate them. We have brokers and agents around the state. They're all getting certified. You shouldn't work with anyone who's not certified from SSLCT. There are going to be storefronts in 6 places, and then there's a wide range of languages. It used to be on the website, if you click language, and it would translate into all this, and that's gone too. But I'm sure they'll bring it back. But there are 32 languages spoken by the sisters. No matter what language people speak, they'll be able to meet their needs. And all of this is free of charge. You don't have to pay extra surcharges for this. Navigators, Hispanic Health Council is the Hartford area one. And the insurance companies are Anthem, Connecticut, Healthy CT, and Husky Medicaid. Because a lot of people are coming in and finding out, oh wow, I'm eligible for Medicaid, that's great. And for dental insurance, it's only Anthem. But Wade, maybe you didn't recognize one of those companies. Everybody know what Healthy CT is? Good. Because I want to be the one to bring you the news first. This is a brand new insurance company. We don't get insurance companies in Connecticut very often. That's why they call us the insurance state, because we're kind of locked down. And it's started by the Connecticut State Medical Society and their practice associates around the state, 3,000 of them. And they decided to create a co-op. And under the Affordable Care Act, remember all that back and forth about should we have a public option or not? And then that 3 years ago, then it turned into, well, maybe a co-op would work. It didn't really work, but they put money aside to start up co-ops that agreed to not just be run by, to the benefit of themselves, but to the benefit of consumers also. So they were not going to have a, I think who's the head of Cigna lives in Simsbury, right? $23 million. That's money taken from our insurance premiums. This company's not going to have a CEO that makes $23 million. The head of Hartford Hospital made $6 million. That money is, it was siphoned from premiums and other costs. It's really that doesn't improve healthcare costs, right? Healthcare quality. And this company is going to plow any surplus back into better care and lower costs. And so they're the new kid on the block, so we're definitely telling people about it. Everybody's heard of Anthem? Nobody's heard of So what are the plans like? They're not discount cheap plans. They're modeled on your typical large employer, good quality plan. They include out-of-pocket costs like copays and deductibles. When you see the doc, it's not free, it's not discount. It's kind of what you're used to seeing if you work for a large employer. And they have to cover, none of these plans could be sold on the exchange if they don't cover all federally and state benefits. And here's the federal list, and it's they cover prescription drugs and pediatric care, and here's the vision and dental for children. This is sort of a short list. There's a lot of detail, and it's just the federal list. But it basically covers all the stuff you'd expect to cover. It doesn't have any huge gaps in it. You can look that up for each individual plan for yourself. And there are 3 levels: bronze, silver, gold. We talked about platinum. It's not happening right now. Less expensive plans, you pay less every monthly premium, but you pay more when you see the doc. $20 instead of 15 or something. More expensive plans, you pay more upfront, but less when you see the doc. That's really the difference. And the discounts, the subsidies, are based on the silver level. So if you really want to be in the gold for some reason, like your doc is there, or you want to pay less out of pocket, you have to pay extra. And if you want to be in the bronze plan, don't count on getting any money back. You won't get any money back. This no wrong door concept is really great. It's coordinated. We've never had like private insurance companies saying, "Oh, ma'am, I think you'd really qualify for Medicaid, and that's more comprehensive and covers you better and costs you less. So why don't you? So I'll sign you up for Medicaid." That's basically what this is doing. If you call up and you start to sign up and you go through the income verification, it turns out you're eligible for Medicaid. They automatically start a number for you, and Department of Social Services contacts you within 2 weeks. And I think about half the people who signed up have found that they are eligible for this existing program, Medicaid, which is really good news because the whole point is to cover more people. So who's going to benefit from this? Obviously, people with no insurance, people paying too much insurance, like Phil and Marion, and people in small businesses and nonprofits. And who's not going to benefit? Well, immigrants who are not legally in this country, who are not legally present, are prohibited by federal law from buying insurance on the health exchange, on Access LCT, from qualifying for subsidies. They can't even buy at full price, so they're not able to benefit. You're not able to benefit in purchasing as individuals and families. And then there are plenty of people who just won't enroll for one reason or another. They can't afford it, like Claudette. It's kind of a close call. They just think that nothing will ever happen to them, and they're made of steel. Whoops. They're opposed to it, religiously or politically or something. I keep doing that, sorry. Or maybe they just have so much money they don't have to worry about insurance, or they don't know anything about it. And that's why we're doing this public education, because everybody knows somebody. If you walk out tonight and ask the next 10 people you know, how you doing for health insurance? Are you all set? You're going to find people who could benefit from this and don't even know about it, or they heard something about it and it was bad, so they're not even going to check it out. You might be able to say, give it another look. And just to nudge people along, there are these very substantial penalties you should get a couple of years down the road. $95 per person, 1% of household income. Claudette's her income is $40,000. Could exempt the first $10,000, so her penalty was $300 for the year. And you can see it ramps up pretty rapidly. And the idea is, it's better for us to be covered. So we get the preventive care, so the costs are shared. So we try to scoop everybody in as much as possible. But there are people who will be exempt from the penalties. They have to say they're exempt and qualify, and here's how. For religious reasons, or if you're undocumented, or if you're incarcerated, or a member of an Indian tribe, or you're so poor that you not even filing an income tax form, or if you have to pay more than 8% of your income for health insurance after taking into account all employer contributions or tax credits. So you may have health insurance at work. It might not be so unaffordable that you can qualify for Access LCT discounts. So you have to pay for it, and they're not going to add an insult to injury and say, if you drop it, if it's so costly that if you'd be impoverished to take it, we're not going to make you even poorer as a result. So those are the exceptions. This is from the Kaiser Family Foundation website. handy infographic for everything. So just to summarize, you know, the 3 steps: you check out, you find out if you're eligible for enrollment, for discount rather, and how much. You choose a plan, what's the best plan for you. It might be, you know, this doctor knows my family more than anything. You've got to make sure to have a plan that, you know, that this doctor is in. It might be, you know, based on cost, monthly or out of pocket. And then you only pay your portion, and then Access LCT, the federal government, pays the other portion, and that adds up to the total premium that the insurance company gets. So now we're at the point where we can go and plug in some real examples. Assuming this works, assuming this doesn't. People want to do this, right? Okay, good. Anybody got a perfect example already? What I need is age and income and where they live, or what county they live in. What county first?
Hartford.
Hartford County. How old?
41.
41. Anybody else in the family?
2 kids.
Okay. So we add a, how old of a kid? How old is the kid?
20 and 15.
20. And this is a dependent. This is this easy. Okay. And then we add, oh, let's just say they're not, and nobody in this family is pregnant, just to make it easier. And 15, you said? Okay, so the 20 person, 15, also dependent. And what's their income?
38,000.
38,000. Now, we're not enrolling, right? We're testing. So you don't have to open up an account and make a password and all that kind of stuff.
Did you put the income in as a gross income or adjusted?
Gross.
Or what is it?
At this stage, it's gross. They'll ask for a lot more detail, and they'll hook up to the IRS to find out. So what I've heard is if you say my income is 41,000, and they check your IRS form and it says 85,000, they'll say, okay, so what happened? You know, why is your income lower? And if you don't have a good explanation, they might wind up going back to the last year's income. If you have a good explanation, my understanding is you have 90 days to prove it. I lost my job. Here's my projected income for the year, because I'm expecting to get a job in the middle of the year. It's 41,000. You know, so especially the first year, they're going to bend a lot of the, be a lot more flexible. So what they found out for this 3-member family is that all of them, the kids and the grown-up, are eligible for high school. Did you know that already, David?
Say that again?
Did you know that already with your suggestion? So did you have a variant that you wanted to do on that? So try something else?
Hiring.
What, raise the income a bit? Same family, everything stays the same. And what's their income?
52.
52,000. I'm taking bets. So it looks like this person has, because the 20-year-old is older than 18, this is true. So the 15-year-old is eligible for Husky, which means they have to, this particular Husky Medicaid, they have to pay. It's not free, but it's pretty discounted. And the rest of the family, the other 2 people, get a discount of $129 a month. And they would probably next go and say, well, what other plans look like? And there are 4 local plans. This is the cheapest. It's $350 to cover the 2 of them. And that's after the $129 subsidy that they get, discount. And so they would check to see if their doctor that they really cared about is in that network or hospital, whatever. They might check here to see, okay, let's redefine print, exactly what's covered by this plan. Yeah, there's a floor. The plans can't be very different, but they're all going to compete based on, we're going to cover acupuncture, we're not going to cover acupuncture, who knows what exactly. And then this is the $6,000 deductible that this gentleman was asking about before. So this only kicks in if you have big expenses. Otherwise, most things are exempt from, most preventative and regular care is exempt from that deductible. And then this is the out-of-pocket protection. So if you go into a coma or you have a huge, hundreds of thousands of dollars in expenses, you're protected past $12,500, which is a lot of money. But at least you don't have you don't lose your house, right? Maybe you do, but you're less likely to lose your house, your business, your life. You're less likely to have to be forced into bankruptcy by medical bills as someone before. you could check out all these plans, all 4 of them, and decide which one's best for you. Yep.
I thought you said there was no co-pays.
There are no copays for preventative.
Some of these plans have no copay, it's just a deductible. Others will have copays and co-insurance. And likely the price will be higher.
Specialist, maybe.
Right, exactly. Well, there's almost always a copay for seeing someone who's not your annual, it's not your annual physical. You get like 1 preventative a year, you can't go every month for a preventative check. Just call it. And then we've heard of doctors saying, people coming home and, I thought this is preventative, but I still got a bill. Well, we have to do some tests, So you gotta kind of be on your toes as a smart consumer. And then these facilities fees, if your local practice gets taken over by a hospital, they might be adding on $100 or $500 or $1,000 facilities fee that you didn't know about. You went last year, you paid a $30 deductible. This year it's $530. This is really unfair and wrong, and they should be disclosing it, but they're not necessarily. So you've got to be on your toes. John?
This is just a quick cut to take a look at it. You see it's a $30 copay for your primary care physician, and it'll be more for a specialist. So there is a copay that's involved in the ones that are showing here. You could, when you click on that yellow for the detail, then you get all of the detail of what it looks like. What all the inpatient hospital, what you charge for x-rays. It gives you, that's where you would take a look then as to one plan to the other, which one makes more sense for you.
And there's an in-network column and out-of-network column, pay more for out-of-network for all these plans. The only reason I'm not clicking there is it's a lot of pages, and we'll do a lot. So you want to put in one more example? Yes?
Mine?
Yep.
I'm 40.
You just told us.
There, okay. Hartford County, age 40, and the age is not that important, but.
How many kids?
And you're we're removing everybody else. Okay. And you're going to be brave and tell us what your income is?
Yeah.
Hypothetically?
Yes, but 24,500.
Okay. That's your laid-off pay. I don't know what.
No, that's not my laid-off pay. That's what it is.
That's your projected income for 2014, basically. So you're eligible for, maybe eligible for cost-sharing reductions. So you're eligible for a monthly discount of $196. And I'll bet at your age, you won't have to pay much more, and we'll find out in a minute. And the cost-sharing reductions are, because your income is in the lower band of above Medicaid level, you might pay $15 to go to the doc instead of $25. So let's go see what's available for you. 4 matching plans. So $120 plus, what was that, $169? That's the total cost of your premium. So this is what you would pay, and that's what they would pay. And these numbers are all a bit different. You're at a lower income level, so you'd be protected from a catastrophic expense if you had something, above $200. You're in a coma and ran out millions of dollars of costs. And your deductible, if you had some sort of medium costs, like you had some ER time or some a small operation or something like that, you would have to pay up to $2,500 out of your own pocket.
So the 120 is per year, per month? What is
The
it?
120 is per month. It's the monthly pay. So that's what you would have to
It's a
pay.
lot of money.
A lot of money. It depends on $24,000. It's not insignificant.
It's big money.
I have Charter Oak right now. It's $589 per month.
Yes,
Yeah.
Charter Oak is a disaster and it will go away.
Yeah.
It was a bad idea to begin with. And,
Remember this number, this income, although you're using maybe the 2012 W-2 or what you think you're making in 2013, it's going to be based on your earnings in 2014. And when
Right.
they do your taxes in 2015 for 2014, that's the number that counts.
Right, so
2012 is unemployed then.
No, I understand, but it's going to end up being the 2014 income.
well, that was the estimate you gave us because you're laid off, right? So a mix of working and not working.
So question I would have for you, David, is it retroactive? If an individual suddenly said, I projecting on making 24,000 and suddenly they get a wonderful job and they're making 52,000.
It's their responsibility to go back in. Otherwise, you get a nasty surprise when you do your taxes
Yeah.
the next year. Because that's where it all gets reconciled.
You get hit in your taxes on that?
That's correct.
Yes.
Because you qualify for these discounts, and then you'll be reporting income, and the IRS will say, wait a minute, this income was higher than what you told us when you qualified for these discounts, now you gotta pay it back. So just like if you lost your job and you suddenly became eligible for discounts, you go to Access Health CT and say, please, can I qualify? If you get your job back, and your low insurance costs are because you had a low income, you need to go back in and say, my income's gone up, maybe I don't qualify for a discount anymore, or it's a smaller discount.
I think you should use the word subsidy,
Subsidy?
because technically it's not a discount. It's
I
a
don't know what these words
subsidy.
mean, so I'm using the ones that people
Well,
understand.
a subsidy is when the federal government, based on your income, says, we are going to pay for part of your premium. So they're giving the money, you can take it two ways. You can receive it monthly, and the government will pay Connecticut or Blue Cross direct.
Yep.
Or you can choose to have the money paid to yourself one time. But it is a subsidy and it is variable based on your income, like he said. But it's not a discount,
voucher,
because someone's
tax credit, all
paying.
true in some way.
We're all, someone's paying the premium.
Yes, yes. We all are.
Just,
Okay, there was a question here, one of you, and then see if you should do
I
that.
just want to ask, alimony, that's considered income?
Gee, who knows the answer to that? I think it is. It's.
I think it is. I think it's childcare is not. If you look on the W-2 or 1040, I think it's adjusted gross income is the number they're concerned about. And I think if you look at the form, alimony is included in adjusted gross income. Childcare, I'm not a tax person. I don't think childcare is included. So I do believe alimony is considered part of your adjusted gross income. And that's what they use from a family standpoint. Excuse me?
When you say childcare, you mean child support?
Child support.
Right. That's what I heard before, but I just.
I have a question. Do you know how different the different networks are?
No, and you have to do a lot of comparison, and that's unfortunate because Access Health CT should be doing that for us, and they're not being tough enough on the insurance company, in my opinion.
And I've read some kind of horror stories where people
Yeah.
go into a hospital and they get, the hospital may be in the network, but the different providers are not in the network, and they.
When I've looked, I've found a lot of providers, and done this experiment, people are finding their providers in the networks, but I don't know, comparison-wise. Let me ask this young lady, ma'am, you had your hand up before, I'm sorry, I missed you.
So if you just became unemployed and so now your insurance will expire, another month.
Yep.
But you have two dependents and you want to make sure you've got care, what number do you put in? Because how can you possibly predict when your income is going to be unemployment until you get a job?
Yeah, so you do your best job, your best guess.
Do you use unemployment
Yeah, absolutely.
as the income?
Yeah, whatever your income is, and whatever if you think of what you might have to do a really careful estimate, like 50% chance I'll have a job by June, that would be a job at about this income level, I think my income's gonna be about X or Y. Or you can say, I have no guarantee of getting a job, let's just stick with unemployment for the year, and the moment I get a job, I'll make sure to go back in and
And
correct my.
just adjust.
Yeah, which is probably what I would do, given the current economy.
And that's kind of the safe way to go, so that you don't get, taxes?
Yeah, you definitely want to go back in and tell them your good fortune or your bad fortune when it happens. So you don't have unless you have a trust fund, you don't have to worry about these things. Writing big checks and everything. Yes, Ida. I'm sorry, Ida and then Anna.
Well, we're finding, as we were enrolling people, I have a coworker who's already helping people enroll, is that the quickest path is if you put in the number from your tax form. So it's 37 on the 1040, and I think it's 4 on the 1040 easy. And if you're using some other method to show your monthly income, it could take a little bit longer. So just, you have to have a little patience with the system because that can take, we found it could take 45 minutes to enroll online.
Right. This is a snapshot. It's not a full enrollment.
If you're going from like 6-figure down to unemployment, you're not going to want to put your
Right. Yeah, absolutely.
that number, which is
Put your current income. And the assister will say, are you sure? Because the IRS is telling you you earned a whole lot more. you may have to, within 90 days, show them a copy of your layoff notice or something. I don't know how it's gonna be. I think they're gonna be a little gentle the first year, and not be such a, a hard enforcement. Anna?
What would happen if this is healthcare plan is specifically for Connecticut? So say I signed up, I got my healthcare plan sorted out, and in 6 months' time I wanted to move to Arizona.
Yeah.
Or
You would join, that's a life event, you would leave here and join there, and it would be seamless.
okay.
I
Or
mean,
what would happen if I wanted to go to say 4 months somewhere in a different state and then come back to
I think the same thing, there might be some minimum, but I think the idea is,
And I'll be able to switch between states, even though the different states, some of them have opted out of this healthcare system.
they haven't. The federal government is operating it in states that have not, that have said we don't want to operate on exchange. So it operates nationwide.
So there is the option to switch if
Yeah.
you want to move.
Okay,
What
so
happened if I go to China? Forget Arizona.
Yeah.
you get really good health care.
There's no such thing there, right?
Emergencies are covered outside of Connecticut. You can go anywhere in the world.
And that
Emergencies.
Just like now.
are
It
covered.
really, it
What's
really
the
is
Right.
good
emergency
now.
there?
Yes.
If I were to sign up in October and then the insurance lapses at, November 1, the current one, and nothing occurs in the next 2 months, so I don't have to retroactively in this COBRA, would I then just automatically be insured starting January 1, or is there?
None of this starts until January 1.
Right, so there's no,
Except for Medicaid, which is, if your kids are eligible for Medicaid now, or you are, then you can sign up that way.
so there's a lap, it doesn't matter anymore. You don't have
This-
insurance for 2 months.
You'll be uninsured. Sorry. This is a quick look at who benefits, like the folks who are eligible for Medicaid. There will be some who are families and kids who just didn't know they were eligible before, but most of them will be these 60,000 adults without children with incomes under about $15,000 each. Then there's this next level. You're an example of that. Not a family of 3, but you're low enough income at this point to qualify for the reduced out-of-pocket costs, as well as the discount, subsidy, voucher, tax credit, whatever we're calling it. And then one notch up from that, and there are a lot of those, 95,000 people, that's a lot of people. And then the one notch up, you get the discounts, vouchers, tax credits, subsidy, but you have to pay full price to go see the doctor, $30 instead of $20, whatever it is. And then there are people who don't get any more discounts, who are above 94,000 for a family of 4. And look how many people are uninsured in that category. They can still come in and buy health insurance on the exchange, pay less than they would on their own, and without the discount, and still be very happy that they've done that. In fact, there were a lot of people who have bought initially, who bought with knowing, as the data that came out last week. And the one caveat to this is that more people on Medicaid than that number. If your kids are on Medicaid, there's a higher income level that you can have and still qualify for Medicaid. And that was a fight this spring, so thank you for it. I'm going to skip over these examples because we're pretty much out of time, and just tell you really quickly what we're doing. A lot of education, a lot of supporting enrollment, getting as much done as possible. We're looking for people who are going through the process and telling us what's happening as they're going through, so we can document it and raise problems as they come up. So if anybody would like to do that, please let me know, that'd be great. And then there are problems, when there are problems, like today, we sent in a bunch of stuff about the broker page and the sister page. So like 8 things wrong with this. And then we're looking forward to when we have more control as a state in 2017. And you can do all kinds of things. You're doing it tonight, educating yourself. You can have a training at your place, a presentation like this or something else. We can come, somebody else can come. We can direct you to other resources. You can become a trainer, become a presenter. We're doing training all the time. And you can help with enrollment. If more than anything else, just ask around. See what people are doing. Are you okay? A lot of people in Connecticut are just fine. A lot of people are paying too much and haven't really thought about it. But they have examples. You have not these 2 sheets, but the national and state, but the individuals and family sheets. And now we're at my favorite part of the agenda. Everybody gets to show off everything they know. I'm not gonna collect these. These are these are all things we've covered. I told you we'd be on the test. So we just do this, what's that?
Who do you work for?
I work for the Universal Healthcare Foundation. So we're a public charity, public support, public education organization.
You're not a state worker.
Oh, my name is David Desiderato. Okay, so what's the name of the new health marketplace? Access Health CT. I told you all would know. Now, how high could your income go up as a family of four and still qualify for discounts? Excellent, good job. Now, how will you be able to sign up for Access Health CT if you want to? All of the above. Excellent. And which of these provisions are part of the Affordable Care Act? Two of them. Correct. No discrimination.
Under 26.
Adults under 26. What about the last one? Wait, we have a mandate, right? Everybody's required to have health insurance. Didn't we hear that? I hear it every night at Fox News. You pay a penalty. Many people will be excused. There are many exemptions. Okay, just want to make that really clear. How many residents are currently uninsured?
307.
Excellent, plus or minus. How many are expected to be insured? Yes, terrific.
What was the answer to that? I'm sorry.
150,000, about half of the uninsured will be covered after the first year. Hopefully it'll go up each year, the penalties go up and it becomes more commonplace. What percent of healthcare costs are spent on diseases that are largely preventable? 75%, correct. What's the name of the new nonprofit co-op insurance company? Healthy CT, very good. Okay, small employers, fewer than 50 employees, will they face penalties if they don't offer insurance? Excellent, great. Oh, the Truth Squad is ready to go. How many of these answers did you not know tonight, before tonight?
All.
Good. Good. So we learned a lot tonight. I don't know if you had, as much fun as maybe we were hoping for. I'm sure everybody's going to go home and soak their heads. But I have a little more information about Access Health CT and like signing up and stuff like that, and there's sisters in the room to help. But what I'd like to do is adjourn the formal session. Anybody who wants to stick around, get extra information.
How do you find the list of the sisters of the state?
Remember that first, when we first looked at the website?
It's right on that, it's right on the website.
Yeah, it says Get Help.
Yeah.
Click on Get Help, and then you can go by, if you know their name, you can put their name in, or you can go by zip code, or,
Cool.
that type. You can do it that way.
See down here, it says Get Help?
Yeah.
And when you go there, you get a choice. Let's look at the bottom first. General help will get you assisters to help generally with families and individuals, and brokers.
Or brokers,
Yeah, so if you put in Simsbury,
And you could put in, zip code, try a couple different ones to get some options. whether
there's
you
so many,
get
have you ever heard of the town of Murdoch?
No.
Yeah. How about the town of Martin? There's a lot of typos in there. This is what I studied when I was today.
Can you do it
Where's
by
Rocky
city?
Hill?
I haven't been able to do it by just.
There's Rocky Hill and there's
Has
Rocky
to be,
Hill.
I didn't try
You
to
spelled Milford without
I
a
haven't been
capital?
doing it much lately because it wasn't
It's all the way
working.
at the bottom.
It should be like region.
So if we search there, we will get the 5 per
We
day.
were getting
first
so
ones
far,
right
it
here.
was just shutting us down, so I haven't gone back on. I was on it today playing with it for a while.
And you
I
can
think it's
email them
okay.
directly, you can call them. Some of them live on Hope Meadow Street, others live on Hope Meadow Street. There are a lot of typos. The assisters list doesn't have as many typos, but it doesn't have 100 brokers. There are 100 brokers on here, and there will be 300 assisters. I think there are like 60 now, I'm guessing.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.